Good day! Today, our group will be presenting the following contents: description, proper usage, demonstration, and counseling of the medical device called nebulizer. Also, our group will be discussing a new device called sirolimus eluting stent.
A nebulizer is a piece of medical equipment or a drug delivery device used to administer medication in the form of a mist, inhaled into the lungs, that allows someone with asthma or similar respiratory illness to deliver medication directly and fast. Nebulizers are commonly used for the treatment of asthma, cystic fibrosis, chronic obstructive pulmonary disease or COPD, and other respiratory diseases or disorders. It is a small machine that turns liquid medication into a mist, enabling faster and simpler absorption into the lungs. Nebulizers are especially good for infants or small children's asthma medications. As mentioned before, it is a machine that turns liquid medication into a mist, which allow infant or small children to increase their medication compliance because they take in their medication while breathing as they normally would. Nebulizers are also helpful when a person has trouble using an asthma inhaler or needs a large dose of an inhaled medication. This is because inhalers require a specific technique to administer asthma medication to the lungs effectively. Nebulizers are considered to be a bit easier to use because you simply inhale medication directly. Nebulized therapy is often called a breathing treatment. It can be used with nebulizers with a variety of medications, both for controlling asthma symptoms and for relief right away. This includes, first, corticosteroids to fight inflammation. Drugs included are budesonide, flunisolide, fluticasone, and triamcinolone. And the second one is bronchodilators to open your airways, such as albuterol, formoterol, levalbuterol, and salmeterol. There are three main types of nebulizers. These are the jet, ultrasonic, and mesh nebulizer. The first one is the jet, which uses compressed gas to make an aerosol, or tiny particles of medication in the air. Jet nebulizers are effective in delivering formulations that cannot be delivered with pressured metered dose inhalers and dry powdered inhalers. For instance, antibiotics, mucolytics, liposomal formulations, and recombinant products such as pulmozyme inhalation solution. These are some of the medication that can be delivered via jet nebulizers. The second one is the ultrasonic. This makes an aerosol through high-frequency vibrations. The particles are larger than with a jet nebulizer. Ultrasonic nebulizer is divided into two categories. First, large volume ultrasonic nebulizer, and second, small volume ultrasonic nebulizer. Whereas the large volume ultrasonic nebulizers are most commonly used to deliver hypertonic saline for sputum induction. Small volume ultrasonic nebulizers are used for delivery of inhaled medications. And lastly, mesh, wherein the liquid passes through a very fine mesh to form the aerosol. This kind of nebulizer puts out the smallest particles. It's also the most expensive. Recent improvements in nebulizer technologies have led to the development of mesh nebulizers using a micropump technology for aerosol production. They force liquid medications through multiple apertures in a mesh or aperture plate in order to generate aerosol. Additional information: nebulizers are either electric or battery powered and are either portable to carry with you or designed to sit on a table and be plugged into the wall. A base that holds an air compressor, a small container for liquid medication, and a tubing that connects the air compressor to the medication container are all included in the mentioned types of nebulizers. Take note that it is important to have a doctor's prescription before purchasing one. It is still possible to purchase a nebulizer machine online without a prescription. However, some medication manufacturers require the use of a specific type of nebulizer, so it is always a good idea to double-check with the pharmacist or a doctor before making a purchase.
It is important to know the different parts of the nebulizer in order to classify and remember its uses. The parts of the nebulizer are the compressor, tubing, medication cup, mouthpiece or face mask, and the nebulizer filter. First, we have the compressor. Compressor is the component that powers the nebulizer system. It's a device that uses a nozzle attached to tubing to drive ambient or outside air through a nozzle. A power source is connected to the compressor. Second, we have the tubing. It is a tube that transports pressured air from the compressor to the medication cup, which vaporizes, aerosolizes, or mists the liquid medicine. Third, we have the medication cup. In this part, the liquid medicine is poured into this container. The liquid medicine is turned to aerosol or mist in this cup by pressured air fed through the tubing by the compressor. Fourth, we have the face mask or mouthpiece. Face mask or mouthpiece is the portion that the patient wears and through which the pharmaceutical mist is inhaled. If the patient is going to wear a face mask, make sure it's snug. Meanwhile, if it will be using a mouthpiece, be sure it's securely positioned between your teeth and that your lips completely cover it. And lastly, we have the nebulizer filters. It is a filter for nebulizers that are integral component of the nebulizer system. The ambient air or oxygen is compressed and pumped via nebulizers, which aids in the conversion of liquid medicine into aerosolized medicine. Before entering the medication cup, the compressed air travels through a filter, which helps to eliminate particles. The filter should be examined and replaced on a regular basis.
Proper usage. First, in using the nebulizer, hands should be well washed. Hand washing is vital in preventing contamination. Second, an air compressor should be connected to the host. Third, put your prescription in the medicine cup. Close the drug cup tightly and keep the mouthpiece straight up and down to avoid spillage. To the medicine cup, connect the host and mouthpiece. Fourth, in your mouth, place the mouthpiece. Maintain a strong seal around the mouthpiece to ensure that all the drug enters your lung. Breathe through your mouth until you've used up all of the medicine. And lastly, when you're finished, turn off the machine. Until your next treatment, wash the medicine cup and mouthpiece with water and air dry.
Many people living with chronic lung diseases such as COPD or asthma may use a nebulizer to administer their medication. Using a nebulizer can certainly be very useful to patients with bronchitis, but be careful about how it breathes. Ensure the effectiveness of the drug. It will only have to breathe through the mouth without using the nose, or otherwise, it will only end up with whatever has not been absorbed by the nasal lining, which means that just a fraction of the drug will make its way to the lungs. Meanwhile, when it comes to sinusitis, ear infections, and rhinitis, breathe only through the nose. Also, when using a nebulizer for these conditions, try to concentrate all the breathing techniques on the organ that is inflamed, which is the nose. Take in mind that in some people who use nebulizers, there are some negative effects that can arise: rapid heartbeat, shakiness, and anxiety are the most common adverse effects. Headache, nausea, vomiting, and throat irritation are the less common adverse effects. Serious side effects from nebulizer therapy can also be possible and should be reported to the prescribing physician all at once. Chest pain, redness, hives, swelling, or difficulty swallowing are severe symptoms. It is very important to gargle after using the nebulizer because it will cause fungal infection, especially when used with steroids. Do not forget to clean the nebulizer carefully after each session. After each treatment, rinse the nebulizer cup with warm water. Shake off excess water and let it air dry. The nebulizer cup, mask, or mouthpiece should be washed in warm, soapy water using a mild detergent at the end of each day. Rinse thoroughly and allow it air dry. Doing this will help to keep bacteria and viruses away from the nebulizer. After the nebulization session, do not sterilize the ampoules using heat, as they are made with polycarbonate or plastic.
Device demonstration. The actual and proper use of a nebulizer is illustrated in this step-by-step procedure. First, prepare all the parts of the device. This includes medicine cup, top piece or cover cap, tube, mask, and compressor machine. Second, get the medicine cup. Third, pour the medicine in the cup with the required dose of the physician. Fourth, cover the cup with the top piece. Fifth, attach the mask on the top piece, then set it aside. Sixth, attach the tube to the compressor. Seventh, attach the other end of the tube to the bottom of the medicine cup. Eighth, let the patient wear the mask. Ninth, attach the tube to the compressor. And lastly, remind the patient to hold the nebulizer in an upright position to prevent spilling and to ensure that the medicine is distributed correctly. Moreover, tell the patient to take regular breaths through the mouth so that the medicine will be absorbed deeply into the lungs.
It took great courage around 30 years ago to tackle stenotic lesions within a diseased coronary artery using the percutaneous approach in an anesthetized human being. Since then, unbelievable progress and research have been taking place worldwide in a continuum that never seems to end. Percutaneous coronary intervention, or PCI, is for the responsible interventional cardiologist, not only an appealing method of coronary revascularization, but also a permanent challenge, as the technical progress must be balanced against the perceived foreseeable risk to the patient. Stents were conceived to make balloon angioplasty safer and more effective. They controlled elastic recoil, negative remodeling, but also stimulated the cellular mechanisms, yielding into instant restenosis. Restenosis after bare metal stenting, or BMS, is mostly due to neointimal proliferation. It was pure mechanical solution to an important biological problem. The development of an anti-proliferative drug-coated stent followed extensive research on the understanding of vascular biology, pharmacology, and experimental and clinical research. The sirolimus eluting stent, or Cypher in the trademark, is a metal stent coated with 140 micrograms of sirolimus blended with synthetic polymers. After stent implantation, sirolimus is slowly released, causing localized cytostatic inhibition of proliferation of vascular smooth muscle cells in the peristent arterial wall over a period of about 1 month. Only minimal amounts of sirolimus enter the bloodstream, and these appear to be insufficient to be of clinical relevance. Also, initial clinical trials with sirolimus eluting stent in patients with de novo coronary lesions have shown a significantly reduced incidence of MACE and restenosis compared with a standard stent. The sirolimus eluting coronary stent, or SES, is a small mesh tube inserted into an artery to keep it open and is coated with slow-release medication to help prevent blood clots from forming in a stent or future blockages. The SES was the first stent-based pharmacological therapy approved for the prevention of restenosis and the first to be approved by the European Community. And it was approved in the Philippines by the FDA in April 2003. It is also the most studied drug-eluting stent today, with the largest body of clinical evidence demonstrating long-term safety and efficacy of its drug and polymer. This stent releases sirolimus, an agent that inhibits vascular smooth muscle cell proliferation. It is very effective in reducing lesions, late LL, and restenosis rates, and represents a breakthrough of interventional cardiology. And the use of sirolimus eluting coronary stent is to treat atherosclerotic lesions in small coronary arteries, may also reduce major adverse cardiac events. Thus, it can help prevent plaque buildup, promote good blood flow to your heart, and relieve chest pain. This may also lower the chance of having heart attack, and the clinical trials have demonstrated the sirolimus eluting stent to be safe and effective in preventing restenosis in de novo coronary artery lesions.
And that is all for today. Thanks for watching.